most famous physical therapist on the internet.
Hi folks, Brad Heining, physical therapist.
Hi, I'm Chris the Pharmacist.
Bob, unfortunately, is not here today. He's enjoying life somewhere else. He'll be back. We're happy to have Chris here today. He's got plenty of expertise for this title, Osteoporosis, Osteopenia, Causes, Treatment, and Can It Be Reversed or Prevented? This is highly researched. You spent many hours on recent research for this. A lot of good information. Before we go any farther, let's introduce our channel again.
All right.
Chris is going to help. Here we've got, go to bobandbrad.com for our giveaway. We are giving away the Booyah Stik. Wonderful tool for exercise, balance, and posture. Also go to Facebook, bobandbrad.com. Pinned to the top of the page, you can also get to the giveaway, as well as Twitter, Instagram, and don't forget TikTok. Anyways, we're done with that. Boy, I got problems with that. I'll keep working on that. Anyways, let's get to the title, Osteoporosis, Osteopenia. Let's clarify that first, Chris. Osteoporosis, osteopenia, what is it and who does it affect?
Sure. Well, I guess osteoporosis and osteopenia, they're both brittle bones, weakening of bones. And osteopenia generally would come before osteoporosis. So it's kind of that gradual stage in between normal bone, you go to osteopenia, and then you go to osteoporosis. So it's kind of stepwise motion there.
So if you have osteopenia, it's not so bad. Your bones are stronger than they are if you have osteoporosis.
Yes.
And that's measured by what they call a T-score. If you go into the doctor, they'll give you some numbers. And I believe if I have this right, negative 1.0 to a negative 2.5 is considered osteopenia.
Correct.
Okay. And if it goes worse, a negative 2.5 or lower, then you're in the osteoporosis range. I think some people hear the name and they really don't fully understand. It happens pretty much to everyone as you age. It's like getting gray hair. So the big thing is you can treat it, self-treat it to a certain degree, and you can do that successfully. So my question is, as a title, can it be reversed or prevented? Yes or no?
The answer is yes. So that's
all the time?
I think most of the time, and you have to kind of adhere to some rules. So basically the big thing with osteoporosis and osteopenia really is to make sure that we're exercising.
Yep.
Because you need to have weight-bearing exercise.
Okay.
And that's going to be one of the key elements of trying to reverse and also or slow it down, depending upon where you are in the spectrum.
Sure.
And
so obviously, as a therapist, you're talking my wheelhouse. So it's like, yes, I can get into this. And what else is there?
Well, besides the exercise, weight-bearing exercise, then we can look at eating our daily diet. We got to eat a healthy, balanced diet. So that's critical, folks. The biggest thing is if you can get your calcium through food. So dairy products, that's kind of the primary one for most of us, but some of us are lactose intolerant. So then we go to nuts, we go to green leafy vegetables.
Okay, but hold on, Chris. Before we go any farther, I think we need to talk about what is the big deal with osteoporosis. What happens if you get osteoporosis? What are the dangers?
Sure, it's brittle bones, Brad. So it means that bones have a higher risk of fracturing. And so they're most commonly found your hip, your spine, and your wrist. So those are the three most common, but it can be anywhere.
We do have this. So in therapy, it's, you've heard of compression fractures.
Yep.
That happens in the vertebra, and these can be very painful. It's going to change your life for a number of months before it heals. A compression fracture in the spine is not like your bone that completely fractures. A vertebra actually crushes, it changes shape, and your body has to heal and readapt to that, which is very uncomfortable. It's not an enjoyable thing at all. The hip, you said, is another thing. Obviously, I've had people that they're pretty old at this point, but literally just walking, osteoporosis so bad that the bone just broke without falling.
Yes.
It's not real common, but it can happen. So obviously, we want to get after this at an early age.
Yes.
So that's the biggest part of osteoporosis is the bone being brittle.
Bone is brittle. Basically, it's just poor. Basically, it's like sandstone. You can kind of, if you actually, the doctors have certain X-ray techniques that are used, and there's a variety of different ones. But when they look at it, the bone actually looks porous. So, and basically, bone is a flexible living material, and
Right.
it's constantly building up and breaking down through all of our lives. And so, what happens is over time, and by 30, that's kind of when it really kind of stops for
Age 30?
about age 30.
Okay,
So
that's pretty young yet.
it's pretty young, and that's kind of one of the keys. That's when we really want to start to pay attention.
So that's across the board, male, female,
Male,
age
female,
30.
doesn't matter. And it's a little bit later for males, but I think 30 is reasonable because a lot of times, a lot of the hormones that govern this are what kind of drives the bone formation and at least the bone loss and
Sure.
reformation and everything else. So when it gets worse for women, menopause, so about 50 is when it really gets bad. For men, our testosterone levels drop off at about 65. So that's when that osteoporosis, that's that window there. So what do you do between 30 and 50? What we do between 30 and 50
Well,
is
and again, at that rate, it started, but it's typically very low.
very, very
You're
low.
not even into osteopenia yet.
No,
You're-
not even.
It's
all.
just
It's just, but this is where we can start to pay some dividends. It's kind of like having a bank and you put money in every week to keep saving it for your retirement. Well, you can think of using calcium
Ah,
the same way.
that's a good analogy. I
So
like
if
that.
we go with that, we're going to try and put calcium in our bank, so to speak. And what do? We're going to do it through diet and
Okay.
exercise are really kind of the
So
primary.
drink a bunch of milk.
Well, yeah, you can as long as you're not lactose intolerant. So, I mean,
Sure.
there's other things that we can use. So, I mean, there's supplements that we can use, and the most common one is going to be calcium carbonate. So that's
So that's a pill form.
pill form,
Okay.
tablet form. So, and then the other one that's
Is that prescription or is that something you could get?
all? We're going to talk about all over the counter products.
Okay.
So yeah, so basically the calcium carbonate, would be in I guess so to think as an antacid like Tums. That's its
Yep.
primary driving force, but you can find it in certain vitamin supplements too. And one of the keys with making calcium to absorb the best is to make sure it's coupled with vitamin D. And so you're going to want to probably about 1,000 IUs of vitamin D. So
So, I'm not an expert at this. I'm thinking, well, vitamin D, calcium, isn't both of that in a good, healthy milk?
sure can be. Now, food is fortified with D in a lot of cases because D is hard to extract out of the diet. So it's very challenging. Actually, the most D that we get is standing right outside in the sunshine.
Sure.
So in about 10 to 15 minutes of controlled exposure, and we have to be careful with skin cancer risk, but 10 to 15 minutes without sunscreen, your body generates about 20,000 IUs of vitamin D or 500 micrograms.
So
So
that's quite a bit.
it's a lot. It's
You're
actually
not going to
enough.
drink that much milk.
You will never ever. Your stomach will explode. So I mean, which is a bad day. So from that standpoint, we're going to have some serious gastrointestinal
So
distress.
for people who don't want to take the pills, even though the pills are across the counter and they're made of, sometimes, are they made out of natural ingredients, you said?
Yep, there's a lot of different ingredients, and when you think of calcium carbonate, it's basically limestone. So I mean, rock, and it can come from crab shells. I mean, there's a lot of different sources of it. So, and people are very, very finicky on what they get for their calcium.
So the pills oftentimes are basically natural ingredients, or they can be.
Yep, they come from the earth. I mean,
Right.
so
Sure. Okay. I've kind of got off track there. But anyways, is there other diet supplements or vitamins that are going to help
yeah.
the bone density?
Absolutely. So we talked about calcium and D. There's different forms of calcium. So again, you got calcium citrate. So sometimes calcium carbonate, which is the most common one, can upset your stomach a little bit. So it can cause things like gas, constipation. So it can be rough on you.
So that's the pill form.
That's the pill
if
form.
it's just calcium carbonate.
Yeah. So then we want to go to something more like calcium citrate. And that doesn't really require, and I should probably backtrack on calcium carbonate. It's the hardest one to break down also. It requires stomach acid. So you want to make sure you take that with food. So when you start to eat, it churns up more stomach acid. So by churning up more stomach acid, what it does, it breaks down that calcium so it absorbs in your intestines better, so it gets in your system better. But some people that bothers their stomachs, so calcium citrate is a lot gentler. But the knock on calcium citrate is you don't get quite as much calcium. So you'll have to take a little bit more to get that 1,000 milligram dose.
So these are, you can just go into
You can go to any pharmacy. You can go to the web. I mean, like Amazon or whatever source that you want to buy a vitamin supplement from, and you can look for calcium supplements. And there are a variety of different ones. And so calcium carbonate, calcium citrate are probably two of the more common sources.
Okay.
But then they have some of the more exotic things where they actually make it out of algae and plant sources as well. So for vegan people or vegetarian people
Right.
or people that just don't, they have maybe stomach troubles with calcium carbonate.
Right,
So
right.
there's options for everybody. But the best is through the diet.
So if we have viewers that are interested, they want to drink their milk, and maybe do a supplement, and they go online, can they just see how many stars
I mean,
they
I
have
think
for a
that's
good option?
I think
Because
that's one way of looking at it. I would tend to be a little bit more critical. I mean, I look for USP ratings because that stands for United States Pharmacopoeia. And so that guarantees, and it's independently lab tested, that what's in that bottle is in that bottle.
okay,
Sometimes, again, I've used that phrase before, it's kind of the wild, wild west, and people mix and match whatever they can
sure.
and give good advertising, but sometimes it's maybe not the best supplement. So that
So
USP kind of guarantees
USP, if that's on there, that's
you're
kind of a
very
quality control.
high quality.
Okay,
And that's what you really want to strive for in just
sure.
about any vitamin or supplement you're taking.
Okay, great, great. I want to go back and touch on exercise a little bit because that's
That's your wheelhouse.
that's yeah. So exercise. Chris and I both swim. I'm a big advocate for swimming in general for exercise, but for this bone density thing, it's not really going to help so much.
No, it's good for the heart, which is excellent. It's good for the muscles, which is excellent. But the problem is it doesn't put that stress or force on the bone.
Exactly.
And the bone needs gravity to try and help to stimulate bone
Right.
formation. So whether it's weightlifting,
Yep.
walking is great.
Mhm.
People like dancing, I mean,
Yep.
jumping around, playing some tennis.
And actually, some impact is helpful.
Yes.
The biggest thing I'm concerned about is when we talk about impact is there's a balance issue then, potential for fall risk. I did hear of one therapist who did classes strictly for bone density with elderly people, and she'd have them hold on to a rail and actually do some gentle bouncing
Sure.
to get that impact so that stimulation for the bone growth
Yep.
would occur. So walking, jogging or running is great, but a lot of people do not want to do that, particularly in their older years. It's, they're concerned about their joint integrity, et cetera. So I think just plain walking,
is excellent.
Right. And it's good for so many other things as well. Is there anything else we need to cover? Now, if this doesn't work, let's say someone's in the osteoporosis and their numbers are low. Are they going to have to go to the doctor and get some?
Yes.
And that's not a big deal. It's used commonly too.
Correct. I mean, it's kind of osteoporosis is a silent disease. So a lot of times we can be walking around, we just don't even know it, and all of a sudden you had a bad fall. Yeah, or you came into your doctor appointment, all of a sudden you're shorter. Chris, I see you're an inch shorter this year. What's up? Well, at that point, it's going to create your clinician to have a mindset that they got to treat you. And so they're going to probably do some x-rays and see where it's at. They'll look at your spine specifically, see if you're a little slouched over. So these are kind of things. So, or if you're also you're having some back pain, you didn't know why. All right. So so you show a little bit shorter. And so it's one of those things where they'll examine that, they'll do the x-rays, the special testing. And then from that standpoint, the mainstay of treatment is going to still be exercise and certainly supplementation, but they're going to use pharmaceuticals.
Sure.
So there's a variety of different medications that they will use to treat osteoporosis. And at that point, depending upon the treatment course and things, and they variety from course to course, treatment to treatment. So it can get pretty complex and pretty expensive. So you always want to check with your insurance company. But it's one of those things that will be a necessary evil to make sure that these people can stay healthy and active as long as we possibly can.
Sure. Absolutely. Wow. We're going to talk about some specific vitamins and for calcium on another video in about a week or so.
Yep.
And so we're going to cover that, in just a few minutes between you and I, but you'll see that video coming up in a week or so. We'll have that one as well. So again, Chris, Bob and I's goal has always been, keep people healthy, fit, and active, and possibly fix everything except for
a broken heart.
And I don't know if this osteoporosis diet and regimen is going to be helpful in that, but we'll see. We'll give it a go.
We'll do our best.
Cheers.
Thank you.